You good rolling? Cool. I'm gonna pull that down. All right, ready? Good afternoon. I want to thank everyone for joining us today. As most of you are aware, last night, Governor Gavin Newsom and the California Department of Public Health declared a state of emergency to support its ongoing efforts in response to monkeypox. Today, the County of San Diego is declaring a local health emergency for monkeypox to align our efforts with the approach taken by the state of California. This will also allow us to strengthen our county's vaccination, prevention, education, and treatment initiatives, and will help our county to be able to prioritize more resources such as vaccines when they become available in greater resource, and could down the line provide additional opportunities surrounding funding. Our county has taken the issue of monkeypox very seriously from the beginning, and those efforts will certainly continue in light of what we are continuing to see moving forward. We started mobilizing our monkeypox response near the end of May, towards the end of May, last week of May, around May 23rd, working with our local health partners. In June, we began our public information campaign and efforts providing information, working with community partners and others. June was also when we had our first 2 locally diagnosed cases, and we continued to ramp up our efforts. In July, we aggressively began advocating with the federal government, both to Secretary Becerra and to other federal leaders, that we needed an increased availability of vaccines. This situation that we face today is fundamentally different than the one that we faced in COVID, and that there already is a vaccine, there is treatment, and we know much more about it. It is also order of magnitude less transmissible than that. But the reality is we need more vaccines, and we will continue to advocate and continue to push for a greater supply and availability of vaccines. The county's monkeypox website updates in real time the vaccine status in terms of how many we have received and how many have been administered. Right now, the County of San Diego has received 3,987 monkeypox vaccines, some of them just recently coming in, 3,987, just under 4,000. 2,454 of those have been administered, and 1,533 are being distributed or used by public health for those who have faced exposure. The way the vaccines are distributed by the state of California is based on a formula based on your population, your number of cases, a variety of other factors. The formula the state of California uses for the distribution to counties is also available and is linked to on our monkeypox vaccine page. And so we encourage people that are curious about how the state is allocating them to visit that site. As we get vaccines, some are held in reserves for folks who have faced exposure. We want to make those available and have those available for folks that have been exposed, and the remaining are being distributed to our healthcare partners and with our community partners to highest risk individuals based on a criteria of the risk that they face. We will continue to advocate and push for more vaccines. We need the federal government to move faster, to make more available to the state, and to get them done quickly. We've had 2 vaccine events where 1,400 San Diegans have received them. We've also provided testing and vaccines at our STD clinics. The county has already distributed 110 treatment courses to area hospitals, community clinics, and county clinics. People who have tested positive and are eligible for treatment can get that through their healthcare providers. To date, we've had no deaths and only 1 documented and verified hospitalization surrounding monkeypox. We've launched an aggressive education campaign working closely with community leaders, with partners, with healthcare systems. We do a standing weekly meeting that we have been doing where we bring in community leaders, our public health experts, elected officials, and others to talk about and hear concerns from the community about what else needs to be done, what should be done, along with sharing information surrounding what we're doing. We've also established a dedicated text alert system. Anyone can sign up for updates on monkeypox by texting COSD monkeypox to 468-311. Additionally, 211 has a lot of information surrounding monkeypox, and people that have questions are also encouraged to call them. All of our efforts will continue. We do multiple presentations. We have done 1 public town hall. We work with our healthcare systems and medical providers, and we will continue to do all of those efforts surrounding that. I also want to thank all of our area local elected officials who have been very engaged in this from the very beginning. I want to thank our mayor, who you'll hear from in a minute. Mayor Todd Gloria has been briefed, has met. We've had multiple conversations, has provided input, working closely. I want to thank our state leaders. President Pro Tem Tony Atkins has been very engaged, talking to the county, advocating with the state, pushing, and I want to say a special thank you to Jason Wise from her office, who's here today, and they've been a regular party to our stakeholder meetings and everything we've been doing. I've spoken directly to Governor Newsom about what we are seeing and what we are facing and where we need to go. I want to recognize and acknowledge Councilmember Stephen Whitburn, who is here with us today, who's also been very engaged in helping distribute information, facilitate conversations with the community, Assemblymember Chris Ward, and multiple colleagues here at the county. You'll hear from Vice Chair Nora Vargas here in a minute. I know Supervisor Lawson Reamer and her team have also been very engaged, and we will continue to work not just with our community partners who have been vital allies and partners in sharing information, distributing information, helping around vaccines and testing and getting all of that out, but also providing a critical link on what else we need to do and where we need to focus. As it relates to the local health emergency, I want to state the obvious. We have come out of a very difficult period around COVID. The situation we face in monkeypox is fundamentally different. This is a very different situation. We take it very seriously, and we are doing everything that we can to respond and move accordingly. But as I mentioned earlier, it is exponentially less transmissible, and we know more about it. We also have a vaccine at the start of this. Now, we need more of it, and we'll continue to push to have more of it. But having vaccines, having treatments, having something that is less transmissible puts us in a very different situation, and so it is fundamentally different than what we encountered during COVID, and our response will really rely on education, prevention, vaccination, and treatment. And we think those are the tools we have at our disposal, and we will continue to use those. I also wanted to share on our website, in addition to updating vaccines, we will, effective today, begin sharing the case counts every single day, and we will update that. Prior to today, we were doing them on Fridays. Today's website reflects 46 cases, which is where we are now, which is just what we had on Friday, plus what we've accumulated since Friday, and we will continue to update that every single day, Monday through Friday. We also will be adding to our website the demographic breakdowns, age, gender, ethnicity, other information surrounding the cases, and we'll continue to do that as we move forward. At this time, monkeypox outbreaks are disproportionately impacting our LGBTQ community, but we know that it can spread to others, and it is vitally important that we not stigmatize any individual, that we not stigmatize any community, or we not cast any aspersions. We have a communicable disease that is spreading through our community. It is predominantly now in one community, but it very well could spread to others. And so as we move forward in these efforts, it is vitally important that we not allow individuals to stigmatize or cast aspersions on a community. And we will continue to do everything we can to keep our community safe, to work with our healthcare partners, to work with our community partners, and all of our elected officials as we move forward, and we'll continue to provide regular updates around this as well. I would now like to introduce and welcome Dr. Wilma Wooten, our Public Health Officer.
Thank you, Chair Fletcher. Good afternoon, everyone, and thank you for being here today. Clusters of monkeypox cases with apparent local transmission were identified in multiple countries, primarily in Europe, in May of this year. The first U.S. case was confirmed on May 20th in Massachusetts. On May 27th, the first case of monkeypox in California was reported, and on June 15th, the first case in San Diego occurred and was reported. Just 2 months later, after the first U.S. case, on July 23rd of this year, the World Health Organization declared the multi-country spread of monkeypox to be a public health emergency of international concern, which constitutes its highest alert level. Yesterday, August 1st, as Chair Fletcher has shared with you, Governor Newsom declared a state of emergency to respond to monkeypox. As of this date, there were more than 20,000 cases of monkeypox globally and more than 4,000 confirmed or probable cases in the United States, with California reporting or experiencing nearly 80, or rather 800, confirmed or probable cases in 27 local public health jurisdictions. This action will allow availability of personnel, such as pharmacists and EMTs, to also administer vaccines, to utilize state resources for vaccine administration, and to leverage the public health infrastructure related to testing, contact tracing, and as well as case investigation, and community outreach and engagement. All of these strategies were developed and strengthened during the COVID-19 response, so we will leverage these strategies during this response. Today, San Diego County is declaring a public health emergency to manage response efforts to the local monkeypox outbreak, including testing, contact tracing, vaccination, and outreach and education. Now, in regards to the statistics for monkeypox locally, of the 46 confirmed, which are 27, and probable, which are 19 cases, there has been one hospitalization and thankfully no deaths. The ages range from 27 to 58 with a median age of 34. All cases are male, and 39 of the cases have self-identified as gay. One case self-identified as heterosexual, and 6 others are unknown. Lastly, there is at least one case that does not have a travel history and is associated with a household transmission. To prevent the community-wide spread of the monkeypox infection, the key is prevention, and this includes vaccinations. There is a limited supply of the vaccine that is available, which is approved by the U.S. FDA for prevention of smallpox and monkeypox disease. Now, please welcome Dr. Ankita Kadakia, one of our Deputy Public Health Officers, who will provide further information about vaccination strategies, including vaccine prioritization, treatment options, and outreach and education efforts. Thank you.
Good afternoon. I'd first like to review some symptoms of monkeypox with you for the public to be aware. Monkeypox can present as a characteristic rash, which is a red raised bump. It can be fluid-filled. Additional symptoms can occur prior to the rash developing, and this could be fever, chills, headache, muscle aches, or swollen lymph nodes. I'd also like to review with you the transmission of monkeypox. Transmission occurs by directly touching a rash or a lesion or scabs of someone that may be infected with monkeypox. Additionally, the transmission can occur by touching objects that someone with the rash could have touched. And this could be utensils, this could be sharing of linens, bedding, or towels. I'd next like to speak to you about vaccine. Jynneos is the vaccine that the federal government has made available for the prevention of monkeypox. The federal government gives vaccine to the California Department of Public Health, or CDPH. CDPH then allocates vaccine to counties, including ours, based on a formula which is posted on our county monkeypox website. To date, we have received 3,987 vaccines and have administered 2,065 for pre-exposure prophylaxis, the prevention of monkeypox, with 559 being held for post-exposure prophylaxis for those individuals that have been exposed to monkeypox. The remainder of the vaccine is being distributed to area healthcare systems and federally qualified health centers. Additionally, there is a drug available for treatment of monkeypox called TPOXX, or tecovirimat. We have distributed 118 courses of treatment to area healthcare systems, and it is available. I would like to take a minute to acknowledge the stigma that the LGBTQ community has faced due to monkeypox. I would like to be clear that this disease is not caused in any way by the LGBTQ community. This disease can and has occurred in individuals outside of this community, including children, pregnant individuals, and those that are immunocompromised. I would like to leave you with 3 tips for protecting yourself from monkeypox. Limit close skin-to-skin contact, especially with someone who has symptoms or a rash. Know the signs. Check yourself and ask your partner about rash or recent illness. Call your healthcare provider if you are experiencing symptoms. Thank you. I will now pass it over to Vice Chair Nora Vargas.
Thank you, Dr. Kadakia. And thank you to everyone, to our county team for the work that has already been done to mitigate the impacts of monkeypox in the community, particularly in our most communities of need. For us, the County of San Diego is obviously the safety net for our region, public health care, and we were going to continue to expand our efforts to deploy the resources and services our communities need in a diligent and equitable manner. For us, health and safety of all San Diegans is our absolute priority. And while the county has taken early action, we're asking for support and collaboration to help us prevent the spread. And like Dr. Wooten and my colleague Chair Fletcher has mentioned, education and prevention is our top priority. As a community, we can all do our part and make sure that we start by knowing what the correct information is, right? To make sure that we help make informed decisions, that we're not spreading misinformation, and we're making sure that people understand what this is. The information has been presented about what websites to go to, but we have that information on our county websites. I want to make sure that we share this with our families and with our friends, and that we are making sure that we are aware of what the risk factors are, the symptoms, and what we can do to protect ourselves to make sure that our communities are healthier and safe. Remember, the virus impacts everyone equally in our county. It's focused on preventing the spread by working closely with the communities that are maybe higher at risk. Para mí es muy importante mencionar esta información en español, pues específicamente para las comunidades que a lo mejor no han tenido esta información y que quieren saber específicamente lo que está sucediendo. Ayer el gobernador Gavin Newsom declaró un estado de emergencia por el brote de la viruela del mono, en colaboración con el Departamento de Salud del Estado y para asegurar la salud y protección de nuestras comunidades. Aquí estamos nosotros ahora como condado para declarar un estado de emergencia en el condado de San Diego local, porque de esta forma nos ayuda a nosotros a poder asegurarnos de contar con los recursos necesarios y tomar las medidas necesarias que se requieren para proteger a las comunidades, y no solamente eso, pero mitigar los impactos de la viruela del mono. Debo enfatizar que nuestro equipo ya ha estado trabajando en la comunidad distribuyendo información y diferentes idiomas, además en las vacunas. Nuestras comunidades locales tienen acceso a estas vacunas y la información se ha prohibido. Pueden encontrar más información en nuestra página de internet en el Condado de San Diego. Además, en nuestro sistema de mensaje de texto ya está activo y pueden suscribirse mandando las letras COSD a Monkeypox al 468-311. Toda esta información va a ser asegurada para que todos la tengan, pero también estamos pidiendo la colaboración del sector salud, de las organizaciones comunitarias y del público en general para que tomen sus precauciones y ayuden a impedir que esta enfermedad se propague. Quiero asegurar que nuestra comunidad, que el condado está preparado para enfrentar estas emergencias sanitarias y estamos comprometidos a que los recursos sean distribuidos de manera equitativa en las comunidades más necesitadas. Es importante enfatizar que esta no es una enfermedad que solamente están estigmatizando a la comunidad LGBTQ, sino que es para cualquier persona de la comunidad se le puede contraer. Lo importante aquí es la prevención. Quiero, importante a todos que muestren esta precaución y trabajemos juntos para reducir la propagación del virus, ya que cualquier persona puede contraer la viruela del mono por el medio del contacto de piel, pero como comentaban los médicos, es sumamente importante que la gente entienda que hay manera de prevenirlo. Vamos a seguir abogando para que haya más vacunas y que la gente tenga lo que necesita. Por favor, ayúdenos a mantener nuestras comunidades sanas y seguras, y si tiene algún tipo de que usted crea que tenga alguna enfermedad, por favor no deje de contactar a su clínica más cercana. Con eso es un honor para mí presentarles al alcalde de San Diego, que siempre ha sido un gran colaborador de la ciudad del condado de San Diego, el alcalde Mayor Todd Gloria. It is my honor now to introduce you to a true partner in our process is the Mayor of San Diego, Todd Gloria.
Thank you, Vice Chair Vargas, and good afternoon, everyone. I'm San Diego Mayor Todd Gloria. I'm joined by City Council Member Stephen Whitburn. Maybe just a lot has already been said. I want to maybe hit on 3 points. First, some comments about gratitude. I'm thankful to all of you for being here. The way that we can tackle and defeat this current outbreak is through education, prevention, vaccination, and treatment. And you're a key component of making sure that the public is well informed about what monkeypox is, what it isn't, and how we collectively can defeat it. So thank you for being here. I want to express appreciation to Governor Gavin Newsom for his state declaration yesterday. I think that was an essential action, and I'm grateful that he took it. I know that he's taking this situation extremely seriously. I had the opportunity to speak with him last night. I'm encouraged by his level of engagement. It gives me hope to make sure that we tackle this thing efficiently and effectively. I want to thank Chairman Fletcher, as well as the entire team here at the county, including the public health officials that are behind me and in the audience. These folks have been working with us very closely over the last couple of months, and I appreciate this declaration today. I like the state declaration. I think it'll be effective in making sure that we can tackle this as quickly as possible. And the second issue or comment would just be around collaboration. As Supervisor Fletcher mentioned, our first case developed here in June 15th. I think we've been in constant communication since that case was identified here in San Diego. We've had multiple meetings, and I appreciate the County of San Diego sending county public health officials to the City of San Diego to brief our staff last week and to get an alignment in terms of communication and message. There should be no doubt that the city and the county are working collaboratively to make sure that we are getting messages, prevention, vaccination, and testing out into the community as quickly as we possibly can. That collaboration extends to many of the nonprofit organizations that are in Councilmember Whitburn's district. His staff and I were on a call yesterday with the County of San Diego with a number of nonprofit organizations, the San Diego LGBT Community Center, San Diego Pride, and other key organizations, making sure that the message is flowing directly to the community, directly to the folks who already work with the high-risk population, making sure that they're informed and taking in feedback and making sure that we're adjusting our response to match the needs of the community. That level of collaboration will continue until this situation is handled, and I will, every effort that the city has, every resource that we have will be made available to the county to further this particular effort. The last thing I want to say, with gratitude, collaboration, is a message about seriousness. And what I want to say is this: I thank and I'm proud to be a member of the LGBTQ community that has taken this issue extremely seriously since the first cases were noted. This community understands and it has experienced outbreaks of viruses in the past. We have seen this before, and we've learned those lessons, and we've taken it very seriously. I want the community to know that the government is taking this seriously as well. The public health community is taking this seriously as well. As mayor of this great city, I want to ask every San Diegan to take this issue seriously. Take a moment to educate yourself about monkeypox, understand the risk factors that are involved, and make sure that you take the proper precautions for yourselves and for your loved ones to make sure that we stop the spread of monkeypox in our community. As you heard from Dr. Kadika, we have not only just we only have vaccines, but we have treatments after the fact. A little bit of education will go a long way to making sure that we stop this spread. Again, I'm grateful to the county for taking the action that they're taking. I know that Governor Newsom is working aggressively to bring more vaccines to bear. I know President Biden is also being extremely helpful, and Secretary Becerra as well. What we need right now are more vaccines. I've heard very clearly from many of my constituents that they're anxious to get vaccinated. They're part of a high-risk population that need to be vaccinated. This declaration today, both at the local and yesterday at the state level, I think will help with that. I think the efforts of the Biden administration will also be helpful with that. And again, the city will do all that we can to be supportive of this effort. What I ask people to do in the meantime is to make smart decisions, to limit your risk as much as possible, and to avail yourself of the tools that are being made available. The County of San Diego has, as has been mentioned, established a text hotline to make sure you're informed and aware of both vaccine and treatment options. Make sure to subscribe to that. Be the first to know when more vaccines are here so that you can get vaccinated. Gratitude to the San Diego LGBT Community Center, who has provided multiple vaccination clinics over the last number of weeks. That undoubtedly is helping with the fight, but we have to do more, and we will do more. We'll continue to apply pressure at the state and federal level to make sure that we get the resources, the vaccines, and the treatments that we need. And here at the local level, we'll work hand in glove with the County of San Diego to make sure that every San Diegan that needs a vaccine will get it, that every San Diegan that needs treatment can get it. And in the meantime, we ask everyone to do everything you can to limit your risk. We can defeat this. I recognize the times we find ourselves in. We've year 3 of the COVID-19 pandemic. We're dealing with a multitude of other challenges, whether it's drought or the inflation or whatever. Listen, we don't get to choose the times choose us. And we have to step up. And I know that San Diegans can step up. We've done that multiple times in recent years. We can do this again. As the supervisor mentioned, this is an order of magnitude less than COVID-19. We can get this done, San Diego. Please take this seriously. Get yourself educated, limit your risk, and engage with all the tools that are being offered by the County of San Diego. We can get this taken care of. And thank you, Chairman Fletcher, for the opportunity to be here today.
Thank you. At this point, we're happy to take questions. Andrew.
I have a bunch of questions about testing, so I'm just going to list them off. Do you have the number of tests that have been administered, the testing positivity rate, average wait time for the results, and are we actually doing testing in San Diego County, or are we still shipping the samples to Los Angeles or Los Angeles?
I think that would be Dr. Kadakia.
So in terms of testing, I don't have that information in regards to the testing positivity rate or, the numbers that we reported currently today are at 46. So of course that's being calculated. There are 5 commercial laboratories that are conducting testing. And this was really to increase the testing capacity. So any healthcare provider and any healthcare system can send tests to these laboratories. Our public health lab is also accepting testing. And we do also work with LA County as well, and we have for a number of years. But the 5 major testing laboratories include Quest and LabCorp. These are easily accessible laboratories that many practices already send labs to for other reasons.
So they're in San Diego?
Yes.
Okay. And the testing positivity rate, is that because you don't have it in front of you, or are you actually gathering that information?
I don't have it in front of me. And I'm sure that we are working based on the numbers. We gave you the latest information that we had today.
Can I answer that?
Yes, please.
In order to calculate testing positivity, you need to know the positives and the negatives. We are only getting the positives. COVID-19 was the first disease where we requested, in addition to the positives, the negatives. So at this point, unless something changes statewide, we will not have a testing positivity. We are only, the information that we have and that is being reported on our website is the number of positive tests. Okay.
I guess the question is like, if everybody's going to get tested, how are we prioritizing resources for testing? And, of the people who suspect they might have monkeypox, how many of those are just really worried and careful, and how many of those are actually tested?
I want to modify my response. If the test comes to our public health lab, we will have that information, but we will not have that information for the entire community. So tests that come to our public health lab, whether when we are sending those out, we know what the number is that are positive and what the number that's negative. But other entities are only report to us the positive tests. Okay, thank you.
And Andrew, I'm going to have Dr. Gadakia. To get a test, you need to have a rash. Absent a rash, they can't perform a test. But if you want to add to that. Say it, Dr. Lee.
That's exactly what I wanted to say. The test is actually swab, and it is done of a vesicle, a rash. So we have to have a rash in order to test for orthopox virus or monkeypox.
Paul.
How do you estimate the size of this at-risk population? In other words, how many doses do you need to do pre-exposure prophylaxis for the at-risk population? What's it nominal?
So I just want to make sure I repeat that question. The question was, how do we estimate how many doses that we need? So we look at the individuals that are at the highest risk. The CDPH uses a formula. The formula to determine vaccine allocation includes how many cases of early syphilis in men and how many cases of monkeypox are in a region. And that determines how vaccine is allocated. For us to determine how many vaccines we need, we look at the number of individuals in the county that are at risk. There are criteria for pre-exposure prophylaxis and post-exposure prophylaxis, meaning individuals that are at higher risk. And that's also, and then the other calculation is individuals who are sexually active. We know that close, intimate contact is one way that the rash of monkeypox is spread. And so looking at those numbers, we have an estimate. We can estimate about 66,000 individuals that could be at risk and we would like to vaccinate. And of course, we've asked the state for the full amount.
We suppose that the community that is in risk right now the risks of anybody in the general population can contract the chain.
That's right.
And also the level of risks, because people is getting an emergency situation, state, county. Is there a possibility of death or not? And the level of risk?
Well, may have the doctors come in and talk about the kind of level of risk and the overall mortality of it. Again, out of the cases we've had, there's only been one hospitalization. And so that's not to diminish how serious it is. I think the mayor and others have asked, so we're asking people to take it seriously. But let me ask one of the public health docs to kind of talk about the overall mortality in general of monkeypox.
Hi, I'm Dr. Eric McDonald. I'm the Chief Medical Officer for the county, ERIC, MC, DO, and ALD. The virus itself has been reported to have differing fatality rates associated with it. Historically, if you look of the two groups of viruses that circulated in Africa, the rates were anywhere from 1 to 10%. But obviously, we're not seeing that with the current outbreak in non-endemic countries. I think the last time I checked, I believe they had up to 10 deaths in Europe, and I don't think we've had any deaths in the United States. So the numbers that Dr. Wooten gave in terms of the numbers of cases, we think that the fatality rate is going to be much, much lower than what has previously been reported before this particular outbreak. And this may be due to multiple factors, probably access to health care, and the general health status of the individuals who are actually affected. You have enough cases of a disease like this, I'm sure that eventually there could be a death in the United States, perhaps in California, but that's what we're trying to avoid by being very aggressive now to get this outbreak under control. Did that answer all parts of your question?
Yes, and one more last question on that. For the mind of the general population, especially in our center, 40% of this Canadians Hispanic, and they trust the news. What can you tell them in that particular risk on their families, and if they contract, that is going to be mortality rates?
Right. I think it's evident from the statistics that we've given locally and across the state and the country that the current number of cases are primarily in the LGBTQ MSM community. And so that's the community that has the highest risk. The general population outside that community, I would say, is exceedingly low risk. And that perhaps the best way I can give that answer.
Why is that? What are you seeing that's determining that?
Well, again, this happens to be the subpopulation this virus went into. The analogy I would use is just, well, no, that's not historically. That's this particular outbreak. Historically, it was actually in specific populations in endemic countries. An analogy I would use is just before COVID, we had a mumps outbreak going on in San Diego amongst college students. That was the group that it was circulating in. That was the subpopulation that socialized together. And that's where we're seeing most of our cases. I would use that analogy that this is the group that the virus has been introduced to, and it's circulating with intimate contact amongst that population.
So then with your awareness and outreach of clinics, et cetera, are we doing that community-wide, or are we focusing in the LGBTQ community?
Well, we focused the bulk of our efforts around the LGBTQ community because, again, as Dr. McDonald just said, that happens to be the population where it's going now. There was an outbreak a number of years ago, I think in Montana or somewhere, a very different population, kind of different situation. But the bulk of our efforts have been focused there. But we're not exclusively limited to that. We are sharing information with the entire community. We are sharing information flyers, the information on the website. We're doing that. We're beginning to do some outreach and awareness and education around the unsheltered populations and community. We don't have any cases from there, but again, proactive engagement, information sharing and awareness, we think is helpful. But we are trying to, today, we're making the information available, and we have been, to the broader community as a whole. So the overwhelming majority of cases have come from one subset of our community. So the bulk of our efforts has been there. But again, this has the potential and probably will likely spread beyond that.
And do you guys have the number of how many people in that at-risk population?
Can I add to that?
Yeah, go ahead.
I just want to clarify or shed a little light. We're talking a lot about the LGBTQ community. So Normally this infection is seen in West Africa and Central Africa, and it's usually in children, families, pregnant women, and that's where we've typically seen monkeypox. However, this current outbreak has been unusual because it then was seen in Europe, which had a larger outbreak before it then came to the United States. But in Europe, the first reported cases were occurring in individuals that attended festivals, and some individuals from the LGBTQ community happened to attend those festivals as well. And so that is why we're having this conversation, and in the current outbreak situation, that there has been transmission in the LGBTQ community, but that doesn't mean that it only exists in the LGBTQ community. It happened to be circumstances where individuals were at festivals or large community gatherings.
Yeah, and I think that's an important point too, because again, we're fighting a stigma, and there can't be any stigmatizing what population or subset. Just as Dr. McDonald said, when you had a mumps outbreak, it wasn't stigmatizing college students. That's just where it happened to go first. And so, we have a community-wide response with the priority, the focus now where we see most cases, but it is a community-wide response. Matt.
Do you guys have that number of how many people are in that current at-risk population?
I think she just gave it to you, 66,000.
66,000?
Yeah.
And then we know vaccines are so limited right now. We know it's a 2-series dose for this. Are you guys prioritizing first doses instead of second?
Yeah, let me have Docs tell you, but we're just doing the one. But you want to talk about the 1 versus 2?
So yes, you're correct. The vaccine supply is severely limited, and that's because monkeypox is a rare disease, right? So the vaccine Jynneos was traditionally made for smallpox, but it is able to be used for monkeypox. And so the federal government has used the Jynneos vaccine from the national stockpile in distributing to states. And so the guidance that we've received from CDPH as well as CDC is a first dose priority. So what this means is the vaccine strategy being used currently is to try to get as many first doses into as many arms as possible. And in this way, we can create some protection for individuals that are at risk by at least getting them 1 dose. And I want to put the point out there that the Jynneos vaccine, even with 1 dose, is 80% effective. With 2 doses, there's 85% effectiveness after 2 weeks after receiving the second dose. So there is some immunity after receiving the first dose, which is why the first dose strategy is being used given limited vaccine supply. When we do have vaccine, to go through the second doses, the county would like to go through and try to vaccinate individuals that are due for their second doses as well. But the current strategy is get as many vaccine in arms as possible.
Do you know when that happened? We keep hearing that vaccine supply shortages in 2023.
I'll take that.
Yeah. Matt, you've been through this with us on vaccines. We don't know. We're advocating for more. We want more. When we get more, we put them in arms, but we can't speculate on when we may get more. We'll keep pushing. Everyone's pushing. Everyone wants more. As quickly as we get them, we'll get them in arms.
To your question earlier, we talked to infectious disease specialists that say if it does go to the widespread community spread, it will spread in daycares and locker rooms. I mean, is that something that
Well, we're not going to speculate on something that hasn't happened. What we know is what we know. We know how many cases we have. We know how many vaccines we have. We know that we're doing everything we possibly can to engage and get those vaccines out, get the education, get the prevention out there, make the treatments available, continue to empower the public with both signs of symptoms along with what they can do to avoid it, and continue to fight every single day to get as many vaccines for San Diego County as we can. We'll do Paul and then back to Andrew, and then we'll be done.
There's some desire for zip code level information on where the cases are occurring.
Yeah.
That's something the county is interested in, not one.
Yeah, I'll have the docs walk through that. But we are, again, cases are being updated daily. Vaccines are being updated on the website. And we'll be sharing demographic breakdowns, age, gender demographics, and I'll have that. I understand. And once I finish, then the doc will come up here and answer the zip code part.
Thank you for that question. At this time, because of the small number that we have, it would be irresponsible to post cases by where they live or the locations or geographic locations that people are living in publicly. So we will not be doing that. If our numbers, and as everyone knows here with COVID, we didn't initially do the breakdown by geographic area or even race and ethnicity until the numbers were much larger, because our first goal is to protect confidentiality of the individuals that these cases that are reported to us. So right now, with the numbers where they are, we will not be placing information on the website for geographic information, or even really right now, race and ethnicity. But we've shared with you all other information. We've provided that because we know that there is most likely not a way you can figure out who someone is. So that is, at this point in time, the answer to your question is no. But if our numbers increase and we don't want to see that, we would share that information. Paul, you know, a couple hundred cases, like Los Angeles and San Francisco, they're over 300. They might break their information down further by race and ethnicity or even geographic area. But again, our numbers are too small to do that at this time. Yeah.
Yes, clarify, please. Prevention is always, you know, we don't know much, and this is in early stages of this. If somebody suspects that has the monkeypox, what to do, what do they need to do, and also, so far, there's no mortality situations in animals and deals of communities.
If someone suspects that if they have a rash, as was stated earlier, then they should seek medical care. Call their medical provider and then get instructions about how that provider wants to see them. So seek medical care if you have a rash. So far, we have had no deaths. And I think that is the last question. Yeah.
Andrew, quick, and then we got to go.
Can you share more details about this hospitalization? Was it for pain management? Was there a
No.
Was it ER visit or just overnight stay?
Yeah, we're not going to share individuals' personal information. Thank you, everyone.